Assalamualaikum and hi. So our group are going to talk about food allergies and food intolerances. So let's get to know more about food allergies and how they differ from food intolerances. So these are my group mates.
Hi, my name is Aina Nansira and I will talk about what does food allergy and food intolerance are. So, food allergy and food intolerance are two different conditions, but they can have very similar symptoms. So many people get confused trying to differentiate between them. Let me explain it to you. So, what is food allergy? Food allergy is an abnormal immune system reaction to certain foods. When someone with a food allergy eats, touches, or sometimes even inhales a small amount of an allergenic food, their immune system mistakenly identifies it as harmful and overreacts. The common symptoms of food allergies are hives or rash, swelling, difficulty breathing, nausea, or vomiting. Next, what does food intolerance mean? Food intolerance is a condition in which the body has difficulty digesting certain foods or reacts negatively to specific substances in those foods. Unlike a food allergy, food intolerance does not involve the immune system and is typically less severe. However, it can still cause discomfort and unpleasant symptoms. The common symptoms of food intolerance are bloating, gas, diarrhea or constipation, nausea, headaches or migraine, and fatigue. We need to know how to differentiate between both of those conditions, where food allergy is an immune-mediated reaction, where it affects the immune system, and that is where food allergies can sometimes be fatal. Whereas food intolerance is not an immune-mediated reaction, it affects the digestive system. Food intolerance is not life-threatening, but it is definitely an inconvenient. We should just remember that food allergy affects our immune system, food intolerance affects our digestive system.
These are the example food allergies and food intolerance.
Now, let's move on to the potential impact of food allergies. First of all, bloated stomach and excessive gas. When the immune system reacts to food allergens, it releases histamines and other inflammatory chemicals that can disrupt the gut lining. This may lead to increased fluid retention and bloating. Next, lower abdominal pain. Immune-mediated inflammation in the gastrointestinal tract leads to discomfort and spasms. Furthermore, constipation also one of the potential. In food allergies, swelling in the intestine can narrow the passage, slowing the movement of stool and contributing to constipation. Next, feeling full. Allergic reaction may also delay gastric emptying, gastroparesis-like symptoms, where food stays in the stomach longer than normal, leading to a prolonged feeling of fullness. Nausea and vomiting. Vomiting is a protective mechanism to limit the allergy's effects. Last but not least, diarrhea. Allergic reaction can increase intestinal motility or cause fluid imbalance leading to diarrhea. This is some example of the potential impact of food allergies.
Next, the effects of intolerance on digestive system. Intolerance in the digestive system typically refers to the inability to properly digest certain foods or substances, leading to symptoms such as bloating, gas, diarrhea, abdominal pain, or other gastrointestinal discomforts. Intolerance have many examples in how they affect our digestive system, and I will explain 4 of those. First, we have lactose intolerant, where there is an insufficient production of lactase, an enzyme that breaks down lactose. Lactose means sugar found in dairy products. Secondly, we have gluten intolerance, which is non-celiac gluten sensitivity, where it is a sensitivity to gluten, which is a protein that is found in wheat, barley, and rye. Third, we have fructose intolerance, which causes difficulty absorbing fructose, a sugar found in fruits, honey, and some processed foods. And lastly, we have histamine intolerance, where it causes excessive histamine levels due to insufficient activity of the enzyme diamine oxidase, DAO, which breaks down histamine in foods.
Hi, my name is Anizulai Kadamia. I will explain how dietary management strategies These strategies are really important for whoever have food allergics or food intolerances. Firstly, we need to read a label carefully. Before purchasing groceries or food product, always check the label carefully. Pay close attention to the list of ingredients and allergen information provided on the packaging. This step is crucial to ensure the product does not contain any ingredients that could trigger an allergic reaction or food intolerance. For example, some product might contain traces of allergens like nuts, gluten, or dairy, even if they're not main ingredients. So, a detailed check is essential. Second, we can also prepare our own meal. By preparing meals at home, you have full control over the ingredient used. This ensures that your meals are allergen-free and reduce the risk of cross-contamination. Additionally, cooking at home allows you to choose fresh and nutritious ingredients, making your meals more balanced and healthier. For instance, you can ensure that your meals are proper mix of proteins, carbohydrates, healthy fats, and fiber. Last but not least, you can consulting with dietitians. Seeking advice from the dietitian is a smart way to maintain a balanced diet while managing food restriction due to allergies or intolerances. Dietitians can also help you create meal plan within specific needs and also provide guidance on safe alternative to replace certain ingredients that you can eat. For example, they can suggest alternative protein sources if you're allergic to dairy or eggs.
Okay, next is diagnosing food allergy. We have 4 methods to diagnose food allergy. We have skin prick test, blood test, oral food challenge, and also auto-pee patch testing. Okay, let's take a look at skin prick test first. Skin prick test, or we call it as SPT, is preferred testing method for true food allergy. It is very safe for everyone, and the result also can get immediately after the test, so you will be able to discuss the result with your doctors. Okay, in this test, a lancet is used to prick the skin under a drop of allergen extract. So when you have allergy to any kind of food, so a raised red bump will appear at that site. Okay, next is oral food challenge, or we call it as OFC. OFC is the most accurate test to determine whether you have a food allergy. It also can determine whether you have outgrown a food allergy. In this test, you will be given a pre-measured dose of a suspected food allergen and be closely monitored in the clinic. In this test, it started when you're eating a small pre-measured dose of food. You are then monitored for a set of interval time. If no allergic symptom during that time, you will be given another dose of food and monitored again. At any sign of an allergic reaction, the doctor will stop the OFC and administer medication as needed. Next is blood test. Blood test can measure your immune system's response to a particular food by measuring the allergen-related antibody known as immunoglobulin E, IgE. For this test, a blood sample will be taken by the doctor to send to a medical laboratory. Okay, if you have allergy to any kind of food, your IgE is more than a normal to that food. Lastly is auto-pee patch testing. Auto-pee patch testing, APT, is used in patients who had documented reaction to a certain food but whose skin prick and blood tests are negative. The APT detects a delay reaction that is not triggered by specific allergen antibody, which is IgE. This so-called cell-mediated type of reaction involves a separated part of immune system.
So my name is Alia, so I'm going to continue with possible complication of food allergies and intolerances. So one of them is swelling or tightness in throat. So I'm going to give you an example. So if you have a nut allergy and you consume foods or drinks that contains nuts, your body could react by blocking your airways. So this is very dangerous as oxygen cannot enter your body and then you will suffer from suffocating. So this can risk your life. Before you eat anything, make sure to check the ingredients or ask people that make your food. Next is hives or welts. So how does hives occur? So this This reaction will occur when you have an allergic reaction by eating or consuming or touch something that you're allergic to. The reason why this happened because our immune system release some sort of chemicals, for example histamine, into our bloodstream because we consume or touch something that we are allergic to. This is a very common reaction. Next is the swelling of our face, eyes, and lips. So this happens when we eat something that we are allergic to. Our body mistaken it as something harmful that enters our body. Therefore, it reacts by the swelling of our face, lips, and eyes. Now we move on to the possible complication associated with food intolerances. One of them is rash, stomach pain, diarrhea, fatigue, headache, stomach aches, gas or bloated, and even runny nose. That's all from us. Thank you.